Many women will have been brushed off. It's all in your head. Just have a glass of wine or just relax. Itchiness is not normal. Pain is not normal. It's definitely a signal from your body that something deserves attention. Sexually transmitted infections cannot be transmitted by sitting on a public toilet seat.
Why do I keep getting reoccurrent yeast infections?
I noticed that in a lot of pharmacies, they're selling some soaps specifically for your vulva or specifically for your vagina. Would these be options that we could try?
Is there any way to reduce vaginal discharge if it's literally never stopping? Welcome back.
Welcome back to the Vulvalution, another episode today. Very exciting one.
Yes, we talked all about, guess what?
The vulva again.
That's right. We're going to keep talking about vulvas until you feel comfortable talking about your vulva.
Yeah. We didn't just talk about the vulva. We also talked about the vagina. And then our guest really mentioned what's normal, what's not normal.
Yes. We talked a lot about how to properly care for your vagina and vulva, whether you should be using all of those products at the drugstore like Vagisil or all those other scented products.
If you need a specific pH, if it's really important to buy these products at the pharmacy.
If you are someone who has chronic itchiness, chronic yeast infections, chronic uncomfortableness when it comes to your vulva or your vagina, this episode is for you.
Yeah, if you're someone that doesn't know if they should sit on a public toilet seat because they could get an STI, just like what I thought before this episode, then that's for you. She answered a lot of questions that I feel like for us it's maybe silly or like we're shy to ask because it's like, oh, we don't really want to talk about it. What if like my vulva's itchy or, yeah. So I hope you like this episode. And if you do, please give us a little subscribe and like our podcast.
Yes. So without further ado,
let's get into it.
Today we could not be joined by a better guest to walk us through it all. Today we are joined by Dr. Melanie Altas, a gynecologist and clinical associate professor with the Department of Obstetrics and Gynecology at UBC. She is also the director of the BC Centre for Vulvar Health at Vancouver General Hospital and is a sexual medicine consultant at BC Cancer Agency.
Dr. Altas' clinical work focuses on vulvar and vaginal conditions, sexual pain disorders, and menopause. But what really stands out is her dedication to empowering patients with knowledge and tools to understand their bodies and advocate for their care. So, Dr. Altas, we're so excited to have you here. Welcome to the Vulvalution.
Thank you, guys. I'm very excited to be here today to talk about something that I'm really passionate about and definitely something I think deserves to have increased awareness. So thank you for promoting this topic.
Absolutely.
Okay, so we'll start with a few little questions just to get to know you a little bit more. So our first question is, what does a typical day look like in your life? Just because, as we mentioned, you have so many different hats as a clinician, professor, and director. So what does a typical day in your life look like?
Yeah, so no 2 days for me are ever the same, which is actually something that I really like about my work. So I split my time between clinical care, so looking after patients in the clinic. We also do a lot of teaching with obstetrics and gynecology residents, as well as research. But typically, I spend the majority of my time directly exploring healing with patients. So through my vulvar disease clinic, through the vulvar pain clinic, through my sexual medicine clinics.
Fantastic. So could you tell us what led you to a career in vulvar and vaginal health? It's kind of like a niche topic. I'm curious what led you here and how you ended up here.
Yeah, it definitely is a niche topic. And it was a long journey to get to where I am right now. So I've been in practice for almost 20 years. And I started out as a general OBGYN. So that means I worked in the community and I delivered babies, I did operations, I covered the emergency room in addition to clinic. And after a few years in practice, I really realized I was connecting with my patients who experienced chronic vulvar conditions. And I realized that this was an underserviced area and also an area that I felt it was really easy to have an impact. So, this wasn't something that we were taught a lot in residency, which unfortunately in North America, it's still not taught very well. But I think there's a lot of ways for physicians to explore and increase their own knowledge. And so I did that through conferences, through mentorship, through asking questions of experts. And I really learned how to manage these conditions well. And then once I started in my practice, it just kind of expanded and expanded. And then came this opportunity to move entirely to Vancouver General Hospital and just work in these clinics. So that means I've given up overnight shifts. I don't work weekends anymore, and that's been really nice.
That is a nice perk. And you're doing the stuff you love. So it sounds like you did a beautiful transition.
Yeah, absolutely. And I really like working with patients who've usually suffered for a while. So having that opportunity to really connect with someone at the point that they begin healing and then following them along that journey is really rewarding.
Mm-hmm.
Yeah, no, I
And it
can.
must be really nice for the patient to be able to open up to someone that actually understands or knows how to treat their problems or wants to treat their problems. Yeah.
Especially probably after seeing so many clinicians or
Mhm.
physicians that maybe don't have the specialty you do and really being heard.
Yeah, yeah, I agree with you. That is something we're trying to change. And I do see a shift with podcasts like this, where it's definitely increasing awareness amongst the general public, but also healthcare providers as well. So hopefully we'll see that underserviced area shift a little bit.
Mhm.
Yes. So you mentioned briefly there that this is definitely an under-researched or underexplored area. Do you have any specific memories of before you got into it, realizing how under-researched or how under looked into this area was?
Yeah, so I think there's so many different layers to answer that question, but it was quite early on in my career that I realized that my knowledge foundation that I had learned through medical school and residency in this area was quite shaky. So it wasn't something that was taught very well. And keep in mind that as a gynecologist, I was a specialist in women's health, and this wasn't something that we learned to the point where I'd be very, very confident. So I think when I started seeing people coming to me who were distressed about chronic symptoms that people tried to manage and they couldn't, and particularly in the area of vulvar pain. So people who experience pain with sex or pain with tampons, that was something that I initially wasn't comfortable managing, but learning how to manage it. So being curious, trying to seek answers and working with my patients as a team that we're going to try to find answers to this and kind of connecting with that relief that people felt when they heard those words.
Yeah. The work you do is very
Mhm.
important, I think. Yeah.
Yeah, I
Mm.
absolutely agree.
Okay. How do people usually react when you tell them that you do vulvar and vaginal health? Do you have any stories of when you told someone how they reacted?
Oh, that's a funny question. It's a great question, though. But one time that comes to mind, or several times along the same theme, was going to conferences, particularly international conferences where you had to go through border control, passport control. And it was really easy to get through passport control with minimal questions because as soon as people would ask, so let's say I'm going to the States, someone would ask, you're coming here, you're going to a conference, and what's your conference on? And I would just say it's on vulvar conditions. And they'd be like, all right, just go through.
No follow-up questions.
No follow-up questions. Yeah.
That's hilarious. They're like, I don't
Yeah.
know what that means.
Yeah.
Yeah. Yeah, and I don't want to know what that means. So
Mhm.
just go through. Enjoy.
Yeah.
That's a great example. I like that story a lot.
Yeah.
Yeah.
Okay. So we want to talk a little bit about stigma before we get into more vulvar-vaginal care. And that's really just because the point of this podcast is to get people talking, try to break down some of those barriers around talking about our vulvas, vaginas, our anatomy in general. So, why do you think there's so much shame or silence around talking about our bodies and our reproductive anatomy in general?
And I think that's a really good foundation to explore vulvar health from. And definitely there's a mix of cultural, historic, and even knowledge barriers around the vulva and the vagina. So for so many years, for even centuries, women's health and particularly women's sexual health has kind of been wrapped in this silence or this embarrassment. So even words like the vulva or vagina kind of makes people feel really uncomfortable or kind of squirm, and you can tell how really deep that stigma runs. And even in our clinics where we have the ability to take photos of conditions that we're seeing so that we can follow people over time, and the photos appear on a TV screen. So the patients have the option if they want to look, and we can point out things, we can educate around anatomy and where to apply like different treatments that we give them. And it's not uncommon for us to hear someone voice words of disgust or shame or that's so gross. I don't know how you can look at that all day. People want us to turn the screen off. And that to me really emphasizes this deep shame and this deep stigma that women and our society has around the vulva. And that's not something we see around the penis for sure, or the male anatomy.
That's
Yeah.
so true. I actually remember the first time I saw a picture of a vagina at a conference, or a vulva actually, at a conference, and I was taken aback, and I had to kind of stop myself and be like, why am I taken aback by this? This is just another part of our anatomy, and it
Yeah.
shouldn't be that way. But even like myself, I totally understand that. So that's such an interesting example to bring up.
Well, some people don't like it,
Yeah,
any
yes.
organs, but yeah, I think that when I saw like an intestine or like your stomach open, I'm like, oh, okay. And then I see a vulva or a vagina open, I'm like, oh,
Yeah.
yeah, which doesn't make
I love
sense.
that you're showing photos. I feel
Yeah.
like that's so nice because you
Mhm.
can't really
Mhm.
Google, like, what is this specific vulvar condition that I have? It's nice that you have that for your patients.
Mhm.
Yeah, and certainly when you get into vulvar conditions, there's a huge spectrum and it's very individualized. And if people do Google their condition, sometimes the worst scenarios will be
Yes.
what they
Yes.
find, which may not be their own experience. But just going back to what you were saying about your own personal reactions to things like the vulva and photos, I think in our society now that would be expected to have that reaction. And I think rather than kind of avoiding that feeling or resisting or trying to push it aside, I think recognizing those feelings that come up and maybe those biases and kind of sitting with them and even questioning those. And that's something I try to do in my clinic. Like just be really curious about someone's reaction. So why does that disgust you? Or why do you feel like shame about that? I think being curious yourself about your own feelings that come up can kind of just lead to expansion and growth, I think
Yeah.
for sure.
I think
Yeah.
it's very interesting because if someone asked me like 5 years ago, why did I feel that way when I saw a photo of a vulva or vagina, I don't think I would know why. I think it's just an internal sensation that I feel, but I don't really know why, which is probably the society that put it on us. I don't know.
Yeah, no, and I think you're right. I think conversations like this are important
Mm-hmm.
to make people start
Yeah.
questioning why they might feel that way and then
Mm-hmm.
start breaking down some of that stigma within themselves.
Yeah.
Yeah, definitely.
I wonder if stigmas around vulvar or vaginal health, do they affect care of people that have issues?
Yeah, I definitely think so. So I do see people who have waited long periods of time before seeking access to care because they felt embarrassed, or maybe a previous provider had brushed them off, or also people don't have the language or the knowledge or the words to, to describe what they're feeling, what they're experiencing, where their symptoms are. So I definitely do see delays in care.
Are there any ways that you in your own practice try to make sure people feel not stigmatized by their issues or feel very welcome to share their issues in your own office?
Yeah, I think there are multiple things that people can do. And I think the most important is to use really clear and non-judgmental language. So calling body parts by their correct names and creating space for any type of question, whether, any big or small type questions. And we're really also mindful of a lot of the words that we use in practice, even just doing exams, like just when we, like for instance, say we're touching a part of the body or we're palpating, we'll try to say that rather than we're feeling. So that just has a little bit more emotion tied to it. Or we'll say things like let your knees fall off to the side rather than like spread your legs. So we're really mindful about language like that. And that's something our clinic has spent a lot of time together navigating and deciding how we're going to explain things. The other thing that I think is really helpful with our clinic that I would encourage other providers to do is to have posters or books kind of scattered around the clinic or the office where you see people, just around things like the vulva or sexual health or women's health. And I think that helps for people to feel that they can ask questions without kind of feeling embarrassed.
Yeah, that's nice. Right when they walk in the door, they feel like it's a welcoming environment where there are no silly questions.
Yeah, exactly. Exactly.
Those are great concrete examples that you guys are implementing. I feel like I want to go to your
Mhm.
clinic. I don't have anything wrong right now, but if I do, I'll be there.
Excellent.
Yeah. And it just reminds me of our logo, which is a big vulva in revolution. So I think
Excellent.
it's good to show the vulva a little bit more.
My mom actually said when she saw the logo, she was like, I love that you guys are putting the vulva out there because I feel like little kids, they always draw penises everywhere.
Yeah.
And we were like, should we just start drawing vulvas everywhere? Like in our
Mhm.
notebooks and stuff like that. Maybe start that trend going instead.
Mhm. Sounds great.
Okay, now we're going to move on to more general questions about vulva and vaginal care before going more into some specific vulva or vaginal conditions. And for that, we're going to play a little game. So I don't know if our audience remember from last episode, we talked about Belinda. So Belinda had a lot of questions about menstrual cycle, but now we're going to do the same game. So Belinda's brilliance or baloney, which brilliance means that she's right, and baloney would mean that she's maybe not right. So we're going to start with our first statement, which is what Belinda thinks. You should wash inside the vagina regularly with soap.
So I would say baloney for sure. So the vagina and the vulva, for the most part, are self-cleaning. So using particularly fragranted soaps with lots of preservatives can actually upset the natural flora of the vagina and vulva and can cause irritation and inflammation. So best
Mhm.
to avoid.
Okay. And I just have a follow-up personal questions. I noticed that in a lot of pharmacy, they're selling some soaps specifically for your vulva or specifically for your vagina. Would these be options that we could try, or would you not recommend them?
So I would not recommend them. I think there are a lot of companies that are taking advantage of the shame and the embarrassment that women feel about the vulva and vagina and are trying to leverage that to sell all of these scented, expensive products that balance the pH,
Mhm.
etc. And truly, the vulva and vagina are really self-cleaning. So actually just using water is fine. And that kind of bothers some people. They can't imagine just using water. So we'd recommend just using really unscented, hypoallergenic products or cleansers. So some really good brands are just the ones that have been around for a long time, like CeraVe, Aveeno, are really good brands to start with.
Okay.
Okay. How about this one? Cotton underwear is better for vulvar health than synthetic materials.
That is correct. So I'd say brilliance. So we definitely recommend cotton underwear when people have vulvar conditions. So if the skin is sensitive or if it's irritated, then that would be one of the first things I would talk to someone about is switching to cotton underwear.
Okay, great. Another statement that Belinda has is douching helps you feel cleaner and prevents infections.
That is baloney for sure, Belinda. So I would say should never do any cleaning inside the vagina, which is what douching is kind of inserting a product into the vagina. And that can really disrupt the vaginal microbiome, so the flora, the normal bacteria, and it can also directly cause inflammation and irritation. So not something we'd recommend.
Okay. Changes in the vulvar or vaginal odor can signal infection or imbalance.
That is brilliance. So, definitely, if you start experiencing a really strong odor, a sudden onset, or an odor that kind of has a fish like odor, then that can definitely suggest an infection. So, something called bacterial vaginosis. So, if there are any changes like that, we'd recommend getting checked out by a provider and not self treating either.
Okay. Healthy vaginas are supposed to have no discharge at all.
And that is not true. So, baloney. So, normal discharge is very healthy. So, it's something that will actually fluctuate throughout the menstrual cycle in premenopausal women, and it can have a protective effect. So, in premenopausal women, discharge is very healthy.
Okay. Another one about discharge. Changes in
Yeah.
discharge can sometimes be an early sign of infection or an STI.
Definitely. So it can be sort of an early warning sign. So if it changes color, consistency, that is persistent, then that it can signal an infection or a bacterial vaginosis or an STI. But also keep in mind what I just said that the discharge can actually cycle throughout a normal menstrual cycle.
Okay. Is there anything that Belinda hasn't covered regarding care and hygiene that you would like to mention?
Yeah, so with this question, I would really like to emphasize that less is best. So, one of the biggest mistakes that we see in our clinic is people who kind of buy into what's being marketed to them, that they need to overclean, they need to overtreat, where they should actually be avoiding scented products, definitely avoiding wipes, definitely avoiding wearing daily liners. So, less is best. So, just water or one of those really mild cleansers if need be.
Okay.
Fantastic. Thank you so much for playing along with Belinda's game. That was lovely. Super
Mhm.
informative for lots of people on their day to day care.
Mhm.
Right.
We want to move on now to some vulvar vaginal conditions. So, people who not just day to day care of their
Mhm.
vulvas, but might have something else going on. So,
Mhm.
when patients come to the Center for Vulvar Health, what are the most common symptoms they're complaining of?
Yeah, definitely by far is itchiness is
Mm,
the most common. So that can be a sign of infection. So like a yeast infection. If people get yeast on the vulvar skin, it can cause itchiness. So it's not necessarily always associated with discharge. With different types of skin conditions, so things like eczema, psoriasis, itchiness can be an early sign. So that's definitely by far the most common.
Are there certain symptoms that people tend to ignore or dismiss for too long that might be a problem in their health later on?
Yeah, I would say the same thing, itchiness. And what we commonly see is that people will experience itchiness. They may think it's a yeast infection. They may self treat, so use over the counter products. Or we'll see sometimes people experience itchiness where they think that it's due to a lack of hygiene, which is not true. And they may kind of buy into that or explore a lot of those over the counter products, which can actually make things worse. So, we will commonly see people who've been experiencing itchiness for a very long period of time before they've decided to seek out seeing a physician.
So would you say that itchiness is not normal, or is there like if you a little itchy it could be normal, but if it's too much, when should we go and see a specialist or a doctor?
Yeah, so I would say itchiness is not normal. So let's say if you start experiencing mild itchiness, is it due to yeast? And I think trying an over-the-counter medication would be reasonable, like Canestin. Or if you're someone who's using a lot of those scented products, maybe the itchiness is due to irritation from some of the components of that product. You could explore stopping those. But if the itchiness doesn't respond to either one of those methods, then I think it deserves checking in with your physician, definitely. So I would say itchiness is not normal.
Okay.
That's important. I think a lot of people are just living with the itchiness,
Mhm.
unfortunately.
Yeah, I agree. I agree. And, I know we're covering a lot in this podcast, but a really good resource for people is to check out a handout on our website. So it's vcvulvarhealth.ca, and we have a skincare handout that people can look at for our recommendations on what to do.
We'll put it in
But
the description of the episode.
perfect. But yeah, if something doesn't respond to your initial steps, then seek out care early for sure.
Okay. And is there any indication with common symptoms of something that might be a simple infection versus something more complex?
So I think that would be something that would be really difficult for someone to figure out on their own. I would say if you're experiencing itchiness and you have that kind of classic yeast-like discharge, like that thick, clumpy, kind of like curdled milk discharge, that kind of goes along with it being a yeast infection. I think you could be pretty confident with that initially. But for the most part, it's really hard for people on their own to tease those things out. And I always advocate for people checking in with their physician as early as possible. And it's not something that's urgent, but what I mean is not to try self-treating for months and months and months on end, which is unfortunately something that we do see often.
I have a follow-up question to what you just mentioned about the typical like cottage cheesy thing that I think people hear with yeast infections. How common is it that people have that symptom versus just having the itchiness or other symptoms?
Yeah. So what's really important is the vulva and the vagina are different. So it's possible to have itchiness within the vagina associated with that discharge that goes along with a vaginal yeast infection. But it's also possible to have no discharge and your skin is on the outside, so on the vulva, is really itchy and inflamed. So it doesn't, like those two can be very separate. And why I would mention that is because we do sometimes see people who go and get swabs done either on their own or with their family doctor, and the vaginal swab is negative for yeast, but they actually have yeast in the skin. So the swab wasn't actually done where the yeast was, which was in the skin.
Oh, and is that why some certain treatment they're gonna have a cream and something to put inside so that it can treat both in case? Okay.
Exactly.
Oh.
Exactly. Yeah.
This is good context.
Yeah.
I don't think I knew this.
Yeah, I didn't know either.
Yeah. Yeah.
So you
Okay.
could self-treat, let's say you have itchiness, but it's not inside. You could just use the cream and not necessarily have to put in the medication inside.
You
Okay.
could. Yeah, you could. And I would say so those over-the-counter yeast treatments are very short term. So if you don't respond within a few days, then I would say that you probably have made the wrong diagnosis for yourself, and then you can go to your family doctor.
Good to know because I feel like some people would buy it again and again.
Yeah.
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 And just think that they have the same problem coming up over and over again.
Yeah.
Okay. So, what are some of the most common conditions that you treat?
Yeah, so we see a lot of a skin condition called lichen sclerosis. Have you heard of that before?
We have.
You
Yeah.
have, okay.
Only because somebody was doing a presentation on it, one of our classes.
Okay, got it.
But I don't think I could explain what it is.
Yeah, so it's a skin condition that can affect the genitals, so it can affect the vulva. And we don't know exactly what causes it. Some people think it's genetic, some people may think it's autoimmune, but we don't truly know the exact etiology. But it's very common and it can affect children, it can affect people who are of reproductive age and postmenopausal women. And it presents with itchiness. It presents with a thinning of the skin, or it can present with a thickening of the skin, which we call lichenification. The skin can sometimes become thin, looks like that cigarette paper. You can also start to see changes in the vulvar anatomy. So one of the common changes we'd see is kind of flattening of the folds of the skin. So that's a common skin condition. I would say it's probably the most common one that we see. So we'd consider it an inflammatory condition. So it's the inflammation that's causing the itchiness and causing the physical exam findings. It's something that is quite easy to diagnose either by just having a doctor look at it, or some people need a biopsy. And we treat it with topical steroids, so steroid creams, and it responds very well.
Mm.
So that's one condition we see a lot of. The second condition that I always like to mention is a condition called vulvodynia. So vulvodynia is a chronic pain condition where people get pain on the vulva, usually around the vaginal opening, and it can cause pain with any type of insertion. So sexual insertion, tampons with pelvic exams. And that can be related to a lot of different things. So, a lot of different potential causes like hormones. It can be due to nerve sensitization, pelvic floor tension, so tightening or contraction of the muscles in the pelvic floor. So, those are the two most common ones that we see.
Mhm.
Interesting.
Are these two conditions treatable or are they like chronic?
Yeah, so lichen sclerosis is a chronic condition. So, it's something that people have for a lifetime. But what I tell people is that we can usually put it into kind of a remission, or so we can manage it. So once we get the acute inflammation stabilized with a regular steroid use, like maybe daily, then we can taper them down to once or twice a week of applying the steroid. So the steroid in that case is to keep them in remission, to prevent inflammation or flare ups, and to prevent further changes to the vulvar anatomy. So it's rare for us to see someone who's refractory to treatment, but we do have some second and third line treatments for that. With the vulvodynia, that is a condition that is treatable. So the treatment is very individualized depending on the contributing factors or the etiology, but that is a condition where we do see improvement with the treatments we have available. And like other chronic pain conditions, so there are some people where they don't have complete resolution of symptoms, and our goal is to optimize their pain and their functioning as best as possible.
Okay.
Mm.
I fear that there's so many people that maybe struggle with lichen sclerosis and are blaming it on other things or are concerned about getting treatment. What would you say to those people who might be hearing this and thinking, "Oh wait, is that for me? Is that about me?"
Yeah, so this would be people who are maybe accepting that their skin is just itchy. They may think that their skin is just dry and itchiness is something that they need to put up with. And for those people, I would certainly encourage them to see a physician and to maybe get a referral to see a gynecologist or to see someone who has an interest in vulvar skin conditions. So that may also be a dermatologist as well.
Mm. And just out of curiosity, how common is this condition?
So it's definitely not rare to me because I see many people every single day. To me, it seems like everyone has it.
Yeah.
So, but that's actually not true. And we think that it's probably underdiagnosed. In the past, historically, I would say lichen sclerosis has mainly been thought to be a condition of postmenopausal women. But we know now that that's not true. And what's likely the case is that people who are premenopausal, it's just not as obvious. And it's not obvious until they get into the postmenopausal years. So, people who have been putting up with maybe some subtle symptoms, so maybe that mild itchiness, maybe there have been some very subtle changes to the skin that the physician hasn't picked up on when doing their pelvic exams. But yeah, it's more common than we think, for
Mm.
sure.
And what about vulvodynia?
Yeah, so vulvodynia is also very common. So the numbers that we usually would say for vulvodynia is probably conservatively 8% of women at some point have had vulvar vaginal pain related to insertion, so sexual activity, tampons. For some people, they may have been there right from the beginning. There are some people who develop what we call secondary vulvodynia, so where it's later in life. But population-based studies have said it's about 8% and maybe even up to 16%.
Mm.
So you definitely know someone who has vulvodynia and they may not be talking about it. They may be kind of suffering in silence with that.
Yeah.
Yeah.
Are there any misconception that you often hear about these two conditions that you mentioned?
So, I would say mostly around the vulvodynia or the let's say sexual pain. So, because when people look at the skin of someone who has vulvodynia, the skin looks normal. It looks healthy for the most part, unless there's a hormonal component. But what's actually going on is underneath the skin. So the nerves underneath the skin are sensitized, the pelvic floor muscles underneath the skin are contracted and kind of dysfunctional. So many women will have been brushed off by their partner, by their close female family members who they've confided in, or their physicians just saying, the skin looks normal. It's all in your head. Just have a glass of wine or just relax. Or, particularly trusted family members have told people the first time you have sex is supposed to be painful. And I've many women who have seen me after many years who've said, I just thought sex was supposed to be painful. So those I would say are the top misconceptions that I hear.
So if it's painful, it's not normal.
Yeah.
It's not normal. It's not
Mhm.
normal. No.
On the mention of pain, I think pain often comes up in vulvar conversations for some people. What
Mhm.
are the most common causes of pain generally outside of vulvodynia? And how do you approach helping patients?
Yeah, so when someone is presenting with vulvar pain, it's really important to do an exam because you need to rule out all of those conditions, some of which we've talked about already. So, rule out all of the inflammation, rule out all of the infections, rule out cancer and precancerous cells because people with lichen sclerosis and eczema may have pain with sex. So all of those things are important to rule out. Then, when we look at someone who is experiencing a vulvar sexual pain when the skin looks healthy, some of the things that can be contributing to it are hormones. So, there's a small subset of women on the birth control pill or hormonal contraception who experience nerve sensitization and atrophy or thinning of the skin around the vaginal opening that can lead to pain. There are people who have maybe had a history of recurrent yeast infections, and the yeast infections stopped, but they still had pain with sex. And we think in that case that the yeast infections have led to nerve sensitization. And there's some people who just have nerve sensitization where we don't know what causes it. So when nerves are sensitized, they cause a burning pain with touch. There's also people with pelvic floor dysfunction, so where their pelvic muscles are really tight. And that may be secondary to pain, but it also may be due to things like anxiety, fear, chronic stress, past traumas, can lead to pelvic floor dysfunction. So those muscles in the pelvic floor are very, very, very strong. And then there can also be psychological component as well. So one of the things that we talk about is something called central sensitization. So this is where the nervous system, so the brain, the spinal cord are sensitized or upregulated, and they start putting a spotlight on the pain that you're experiencing in the body. And when the pain is spotlighted, it can kind of exaggerate the pain. And for some people, all of those things can be contributing. For some people, maybe there's one more than the other. But it's really important when you're assessing someone who has vulvodynia or vulvar sexual pain, what for that person, what are the contributing factors? And then designing a treatment plan that addresses those contributing factors.
Very
Okay.
interesting.
Okay.
Now let's move on to our section, what women really want to know. So our audience before this podcast, they asked some questions anonymously, and then we're going to ask them to you.
Sounds good.
So the first one is, why do I keep getting recurrent yeast infections?
Yeah. So if yeast keeps coming back, so definitely what I would make sure is that you have confirmed the diagnosis so that you've seen your family doctor and you've actually had a swab that has confirmed yeast, because there are a lot of conditions that can mimic it. Then, what is also really important for people where it's documented and they keep getting yeast infections, it's also important to continue confirming those with a swab, because sometimes there can be a strain of yeast that is more resistant to the common medications we use to treat yeast. So, like the canestin or a pill called diflucan. And you would need to confirm that with a vaginal swab through your doctor. Then there are also people who have what I would say are risk factors for recurrent yeast. So that would be like someone who has poorly controlled diabetes. So yeast loves sugar, and if the diabetes is not well controlled, it can feed on that sugar. People who maybe take recurrent courses of antibiotics, that puts them at higher risk of yeast. There's some people when they're on hormonal contraception, particularly the birth control pill, it may increase their yeast infections. However, there is a small percentage of people where all of those things are negative and they just keep getting recurrent yeast infections that require recurrent courses of anti-yeast medication. Or there's some people who even need to be on what we call maintenance or suppression. So where they take something maybe once a week, once a month, whatever works for them. And we don't quite know why that small percentage of people continue to get recurrent yeast infections.
Okay. Another question that some of our audience had, but also I had personally, was can I get an STI if I sit on a public toilet? I've been told by my mom, my grandma, every woman in my family that I should never sit on a public toilet. So I have to squat. And when I told you, Sabrina, and others of my friends here, they said that they always sit.
Sexually transmitted infections cannot be transmitted by sitting on a public toilet seat. So those type of infections need actually direct contact between mucous membranes or contact through almost immediately through body fluid exchange. So bacteria, viruses, they don't survive for long periods of time on surfaces like a toilet seat. You're probably much more likely to get a cold or a flu by touching a doorknob or something like that.
Okay.
Just because of the frequency that people do that, but definitely not a toilet seat at all.
Okay. So there's no risk sitting directly on a toilet seat.
No,
Okay.
there's not.
You
Good-
can sit.
good
It's like
to
a
know.
chair. Get
Yeah.
comfortable.
Yeah.
For
Less
sure.
squatting for me, for sure. Okay.
Yeah.
You're gonna lose some leg muscles, maybe. But
Maybe.
it'll be comfortable.
Mhm, mhm.
Last one from our audience is there any way to reduce vaginal discharge if it's literally never stopping? My doctor says it's normal, but it's quite annoying for me.
Yeah. This is a hard question that we get every once in a while. So the kind of the short answer is no. Let's say once an infection is ruled out or inflammation, or if everything is kind of healthy, we definitely do see some people who are just really bothered by a heavy normal discharge. And unfortunately, right now within medicine, we don't have the answers for that. So we don't have anything to improve that or to change that. And I would just kind of also put a caveat there that there's also a lot about vulvar and vaginal health that we don't know. And there's a lot about something called the microbiome, which people are starting to hear that on social media and in magazines and newspapers. So that may be a familiar word to your public. But There's a lot that we don't know about the microbiome. And so there may be contributing factors of diet or environment, but right now we just don't know the answer to that, and we don't have a fix for that.
Okay. Well, that's good
Yeah.
information to know.
Okay, now let's just wrap up. So, what's one small way that people can start caring more about their vulva or vagina health today? Like, what is something that it can start changing now?
Yeah, yeah. So I think you guys have covered a lot of stuff. So I think just listening to your podcast will be helpful for most people. But just kind of keeping things really simple, I would just start by getting comfortable using the word vulva, and kind of getting comfortable with with your own body around that. And also, I would definitely say keeping things really simple. So gentle care, warm water, cotton fabrics are a really good place to start. Just keep it simple.
Fantastic. And are there any websites or resources, books that you want to recommend for anyone who has further questions at all?
Yeah, so on our website, we have a lot of handouts. So our website is bcvulvarhealth.ca. And we have a lot of patient handouts on all the conditions that we've talked about today, including skincare. And we also have translated our most popular ones into French, Punjabi, and Chinese. So I would definitely start by exploring that. For people who are interested in learning more about vulvodynia, we've also created a toolkit for family doctors. It's called vulvodyniatoolkit.ca or .com. Okay, it's .com actually. So people can also explore that as well. The other, when I'm recommending books to people, a really good book to start with around vulvar and vaginal health is by a gynecologist. She's Canadian originally, but she works in the States right now. And her name is Dr. Jennifer Gunter. And she wrote a book called The Vagina Bible. So that's a common book that I recommend.
Love the name. Thank you for sharing those resources.
Now, the final question that we ask all of our guests, if you could bust one myth about women's health today, what would it be?
So I would say, oh, God, there's so many, but I would say that pain is not normal. It's definitely a signal from your body that something deserves attention. And also, talking about it isn't embarrassing. It's actually empowering, I think.
That's what we're trying to do with the podcast. Make it empowering and not scary and normal. Woo. I'm getting
Yeah,
excited.
yeah, I agree.
Okay, and last question, another big one. What is one change you hope to see in women's health in the next 10 years?
Okay, just one. Oh, there's so many. I would say that definitely universal access to multidisciplinary care. So I would hope that people could have equal access to a gynecologist, a physiotherapist, psychologist, because all of these things that I have mentioned to you do require multidisciplinary care. And right now we are limited by financial barriers because psychology is not readily available to everyone. I would also want more research and more education in med school and residency on vulvar conditions and on women's sexual health.
Fantastic. Great answer.
Yeah.
Okay, well, thank you so much for joining us today. I think our audience is going to love this episode.
Yes.
Excellent. Thank you for having me, guys.